A hearty good afternoon to everyone, and welcome to our session on the topic of nutrition and fertility. We are pleased to have Dr. Vijay Geeta Patangi among us to educate us on this topic. She's a clinical counselor with a PhD in clinical health psychology, and she's the best person to educate us over how a well balanced diet plays a vital role in improving fertility. Doctor, you're on the stage.
Thank you. So, with further delay, we'll just get into the topic. Today's topic for the session is nutrition and fertility. We've heard a lot about nutrition, and we've also heard a lot about talking about nutrition in the previous session. But it just doesn't justify what is the importance and how it is impacting, or is it really very important, is one cadre of patient's question. And some is like, I am eating, but the question will be, are you eating right? And then what is the right, how it is impacting, it's one cadre of questions. So today's session is purely based on research papers until 2019, which got the attention on how nutrition affects the fertility, how is it is enhancing, and how it is benefiting people. It's an interdependent correlation. Is a paper obviously done and published, and this actually caught the attention. The most recently published one. So the infertility on the major population is on a rise, and we see the rise around every 20 to 30 percentage every year. Predominantly, we see a equal number of percentages increasing even among male infertilities. We currently see that a lot. So we can say two reasons that one, there's more psychologically people are open up, they wanted to know whether the fertility aspect from the male is also correct. So there's a lot of people who come volunteer themselves to check, get to know about the fertility health even before marriage or post marriage. And two, they're more vocalizing or opening up to say, yes, I do have this issue, is there anything that can be done? Well, a lots can be done. And going back, iterating, stating that the earlier it is identified, it's very very easy to reconcile. We can put into minimum medication or absolutely no medication, as simple as a small lifestyle changes like diet is what all about that it is required to do so. That is all about on today's session, and how the research has also showed the correlation part and how it increases the fertility aspect, on how long to practice and how to go about is all about today's session. So the title and the content of the entire is listed all towards hormone, the endocrine glands, and the fertility aspect. Why nutrition comes is because nutrition is not directing, affecting, or causing either a fertility or an infertility. It is the hormones that does so. But what makes the hormone to do, or what triggers or stimulates the hormones to a certain behavior, either a normal behavior or an abnormal behavior, that leads as a cause to either affect the person's fertility or becomes a reason for infertility, comes to the picture, is all the entire talk is all about. So since hormones is directly impacted with nutrition, and sorry, hormones is directly impacted with vitamins and minerals, and that way we find all these nourishments of vitamins and minerals and nutrients and all that is the immediate natural sources of our food. So that is why nutrition is the topic, and we are having the relativity towards fertility. According to the research conducted, they first conducted with one hormone, and so they're trying to finalize with other hormones. What are the most classical things that we see among the reproductive population is not only age is really very less. We see a lot of lifestyle changes post COVID. If you've seen that there's a lot of psychological adjustment that is tasking to either move out of your comfort zone to work, because most of you are accustomed to work within the most comfortable zone, which is your own home, your own room, in your own comfortable furniture, is now hesitating to move around or to travel. So if we see, a lot of sedentary lifestyle has gradually royally carpeted in, and if tucked into this newly built-in lifestyle, it is difficult for us now to move on. So there's a lot of lethargy, there's a lot of obesity, there's a lot of lack of physical body functioning, all adds up to a and hormonal imbalance which is already existing in the body. Not everything is balanced, right? So in 1 month one hormone will be high, in a few days the other hormone will be high, the hormone that is high will die down. So it's all cyclical, but the cycle should be within the normal range, which usually is not happening because of predominantly what we see is the lifestyle changes. So according to the research, the macronutrient which modifies the absorption of the nutrition, or how the nutrition impacts the hormone, was first seen in the hormone leptin. The study suggests that the leptin hormone is usually available from a person from the fatty tissues or the adipose tissues. So a person who is high in fat, or has a carbohydrate very rich food with fructose and sucrose, and low in protein, are some of the common problems also that we come to see, that the leptin hormones also becomes resistant to such person. Oh, this is too confusing, ma'am, because you're not able to identify the correlate. So let's look into that a bit deeper. The deepest understanding would come when we start discussing. So I would encourage all the participants to post your questions, so that we can also entertain the questions and have an interactive session. So the leptin plays a very important role, not only in a physiological process, like in the case of ladies as menstruations and pregnancies, but also in male, towards you have your abdominal belly that forms up, which is adipose tissues building up in the body due to very sedentary lifestyle, is one thing that's identified. It also affects the liver in a male. So these are the two things that's identified commonly, since it's the female who walks in to look towards fertility factors, and the fertility factor starts in a female's life the moment the puberty starts in. So whether it is an amenorrhea, which is this lack of periods, or dysmenorrhea, or painful periods, or excessive bleeding, all comes to the picture, and since then it gets monitored. The most common thing that even a doctor would say is, what did you eat for the past some time? So the sometime also is equally important. Note why the sometime is very important. And the characteristics of abnormal leptin levels are also characterized with severe changes in the body associated with dietary habits, is what the research also says. Since leptin is regulated by a body composition and dietary habits, it varies from person to person, because it also affects the nutritional intake, and the composition of the macronutrient is also being disturbed. And this is highly confirmed that the nutritional intake and fertility is regulated by a hormone called leptin through this current research study. Okay. And sometimes this research also has said that in certain cases, though the neuroendocrine and metabolic aberrations are seen, it also needs a deeper level to understand why in certain cases it's not the same. So looking ahead further, why the nutrition status is very important. The concept of nutrition and associating with the fertility factor all started dated around 1970s by Frisch, whose hypothesis was on fertility and nutrition. This is where it all started, documenting on how it happened, how the mechanism of body fat, implied towards menstrual cycle, and how periods started happening. How was the flow? Whether it was painful, not painful. How the hormones affected the endometrium. How the hormones affected the ovaries. How the hormone affected the thalamus. How the hormones affected pituitary gland, where your pituitary gland, your hypothalamus, ovaries, and your endometrium are all one of the important factors that contributes towards fertility aspect of a person. So this is how fertility and the leptin hormone started linking towards, and the journey started from the year 1970 till now. Where is the study come? the hormone exerts a lot of action, has its impact on the action of ovaries. So sometimes there can be PCOD as a reason, sometimes there can be too much of exercise, and then you have an absence of periods. So leptin hormone has an impact along with exercise which comes to the picture. They also affect and interfere with the development of a dominant follicle, and also associated with oocyte maturation. These are all the common uh, conditions that comes up as a reason. Oops, sorry, the dominant follicle did not turn up, so we will try your pregnancy stimulation probably next periodical cycle, and doctor prescribes certain things. Please be vigilant to see that you need to be very stringent and strict in following the medication aspect what the doctor gives, because nobody takes it so importantly. It is taken very light. Okay, it is another multivitamin, or is there some supplement that's given to enhance, and then a lot of gaps comes to the picture, and once the result that is expected out of it is not seen, so the frustration builds up. Leptin has also a physiological role in the implantation also. So they contribute in most of the cases towards healthy body fat mass. So if you are on a plumpier side, with certain people, we also see that it sustains a normal ovulation cycle, and with a specific range of the leptin levels. However, even menstrual irregularities are also seen, specifically people who are associated with sports or very excessive physical activities where the body fat mass is really very low. That's why it is told sometimes that when your doctor checks you and says, hey, you need to take rest, or you need to do a little bit more exercises or workout to reduce your body fat mass, so that you will not go towards leptin resistance, but probably so that your good nutrition absorption takes place, because this is mainly one of the reasons that they can look for. Usually the hormones was more correlated with anorexia nervosa, which people who had eating disorders, or bulimia nervosa, which is again an eating disorder, where both contribute towards fertility issues among females, is closely seen. Hence, now it is clearly identified that leptin is one of the major hormones that comes to the picture. Apart from this, why the diet plays an important role is because most of the nutrition, the absorption of the nutrition from the food towards the bodies, is involving cellular mechanism, and leptin is one of the hormones that also contributes towards the work, very specifically your insulin levels. So this is how the role of leptin through research is documented, and has now come to an evidence to say that, yeah, eating habits, one of the most important lifestyle mechanism that has an impact in a person's reproductive mechanism, is now identified. So you're not too obese, at the same time you're not too lean, but still, if you have hormonal imbalances, time to take serious consideration and start working towards that. Now, when will you identify an hormonal imbalance? Do you need to be married? Do you need to look only when you're looking for pregnancy? No. Hormonal imbalances can be identified as early as, let's say, you are having irregular periods. So once you start monitoring from then onwards, it's easy for a person to, let's say, plan for a pregnancy whenever probably having a family, and then you immediately decide to do so. This is one important lifestyle advice that I would like to say for everyone, to start looking into it. Why? Because of the hormonal fluctuation. We all know now that the immediate response or go-to item that we would look into for all the nutrients, so that the hormones works properly, and then all parts of your body works, like your cardios, your lung mechanism, your fertility mechanism, all works correctly, we go towards food. So yeah, displaying here is a small pyramid which usually or commonly everybody should have in the mind, predominantly in your plate. What is the major things that go? This is the most common food mechanism everybody will look into. But What is the difference? The current research, which says that hormones do regulate, has a small input here. Among females, you should see that there is a lot of protein rich diet when compared to a carbohydrate rich diet. In a male, there should be a lot of carbohydrate rich diet when compared to a protein rich diet, or a 50-50 benefits a lot during the let's say family planning or something like that, because a lot of protein is involved, which strengthens, which affects the periods, which affects the endometrium thickness, which affects the quality of egg, comes to the picture. Lot of focus is need to be given to that to function, because a lot of amino acids comes to the picture. There's a lot of function that's involved in the macronutrients. For a male, not much is required, though he needs equal amount of energy and equal amount of hormones. To a male, the food can be dispersed as equal, half the plate of protein rich diet and half the plate of carbohydrate rich diet would do good. Whereas among females, it is nice to have a protein rich diet, and three-fourths of the carbohydrates is sufficient for the person to go ahead. Why are we talking all this? This is one of the synthesis that I'm trying to show, which will not be understood to a common person, is because if you look, a lot of vitamins and minerals play a role in the synthesizing aspect, where we are trying to get these vitamins and minerals from our food and how important they are. Some of the natural sources for such molecules to be absorbed, like for example, doctor would have suggested lycopene, and lycopene is a very common ingredient in a tomato or in a grapefruit or as simple as papaya. And what are some of the benefits of having tomatoes and grapefruits and papaya? It is an anti-inflammatory, it is anti-angiogenic hormone. It affects very nicely towards lung function, towards breastfeeding if they are expecting mothers, or mothers, towards pancreatic functions, towards colon functions. What are the molecules that's present in these food is listed here, which is also benefited towards a fertility aspect. Some other food that also supports during these fertility things are your polysaturated fatty acids. And what do we use mostly to cook? Currently we use a lot of sunflower oil, olive oils. We tend to eat a lot of spinach. Doctor would say add a lot of greens in your food, ma. What does that bring to the picture? Since it again has an anti-inflammatory and anti-apoptotic properties, it works good towards your colon, your breast, your prostates, and blood and pancreas. It also has an impact on your functions of ovarians. Your multivitamin tablets, if whatever doctor recommends, if you go through the contents, mostly will have your anti-inflammatory mechanisms. It supports your ovarian functions. It would support your skin. It supports a person's prostate gland. It supports a lot of the organs that gets targeted. So rather than going for artificially to identify the molecules and swallow, we look towards the natural sources. This is one such example. In one of the contributing research in the same year 2019, by the data being purely collected by nursing staff who closely worked with fertility cases, what they have heard and documented is people who eat very less carbohydrate in their diet tend to have a good response among females, because it has an impact in the glycemic index, which is the insulin, and there was a better outcome in the pregnancy level. Whereas among male, it had a very different impact in a seminar angiogram. Lipids, which are healthy fats, when consumed in the right portion, the functionality of the menstrual cycle among such ladies was healthy. They had a 28-day cycle period, and then the ovulation was smooth, nothing much. And also, protein rich diet, when it was seen, there was an increase of good ovulation, good follicles, good ovaries, not ovaries, the oocytes, and there was an increase by 2% every month when they followed. Among females, it increased, and among males there was a increase in response by 0.78 percentage, is what was the research document says. Also, the most common tablet that a doctor would give is a folic acid, which is a folates. Doctor would also say tablet is not the miracle. You should also include a lot of green leafy vegetables, beets, carrots, and that also helps in absorption. Found out to be beneficial, where they tend to supply B6, B9, and B12 vitamins. Iron supplements, though rarely given, has its positive impact among females who's looking towards conception. And these are some of the research data which says that through the nursing staff who actually verbally listen. Well, this is a common gesture, right? When you ask a person, what did you eat today? Okay, yesterday you ate this, today you ate that. And then let's say there are 10 fertility cases that's come up, they're just being monitored. And then the doctor will look into the medical aspect, whereas the nurse will look into the not the psychology, the dietary and other impacts. When they come to a counselor, when the patient gets educated how the physiology and what the nurses had told, how your habits has an impact, is it a positive correlate or is it a negative correlate, or what can be altered to enhance forthgoing cycle, brings in a positive outcome. What are we seeing here? We are looking the first major thing in our hands, which is our molecules that is required for a healthy hormonal functions. Let's say towards a good fertility health, we are looking food as our immediate source. Food for healthy source of proteins, and also for a healthy resources of antioxidants. Though rarely most of the antioxidants is not completely individually available as a tablet, we still rely on food because everything cannot be synthetically available. Protein and antioxidants has its impact on hormones. We would have commonly seen our doctors responding, okay, let's do this blood test. It is the same hormones that the doctor would repeat, which sometimes confuses the patient to say, like, why you are not considering the previous month's blood test, why it's only now. How come last month I was 56 and this month I have gained weight by 58? Is it a healthy body weight gain, or do I need to do any activity to reduce the weight? All these factors are very subjective and needs to be understood, whether there is no insulin resistant factors building in the body, thereby leading to diabetes, or there is no hormonal fluctuation that also contributes towards infertility. All these medical related is what the doctor would focus into. All these are facilitating steps for a couple who's actually planning for a family. Why? Most of your major hormones, your AMH, your FSH, LH, estrogen, progesterone, all hormones are being impacted by the molecules, and these molecules are readily available in our food as our resource, which has its impact on the outcome. Now, some of the important factors which is seen, because it's predominantly almost, let's say, in a couple, a women's role is almost 60 percentage or to 80 percentage. A male's role is just 20 percentage. But still, factors underlying remains the same. There's a lot of apart from just hormonal fluctuations, there are a lot of diseases that causes or affects the fertility aspect among a couple. One is a lifestyle. What are the factors that can come in a lifestyle? The factors can be as simple as our age, two, working environment, three, you can have your smoking, your coffees, your alcohol abuses, or anything. Or very simple, I have a like towards this kind of eating, I dislike this kind of eating, or something like that, which is basically a nutritional style and body weight. Because one point everybody, or as a person would carry in the head, I don't want to become obese. So if that is a point, or I have a particular way to take care of myself, so usually common body behavior which any person would do is, I would try to avoid this because I'm looking towards weight loss, but usually that doesn't work. Okay. What are the other important life factors that is seen impacting is our nutritional disorder. Without knowing which food is having what nutrients, or is that nutrients, despite putting it into your body, are they being utilized or absorbed? is all not well documented. So, particularly in women, abnormal nutrition may sometimes permanently affect an oocyte maturation. And for a better understanding of what has happened, why this malnourishment is affecting, the solutions are always identified by restoring proper reproductive functions, which is what our doctors sincerely do. So, follow the medications or the treatment line sincerely. Malnutrition is not about the images that come to our head of a very lean, bone revealing person. It's not like that. Food deficient in the important nutrition which is necessary for my today's activity or plan is not there. So aren't that person or that kind of a person is malnourished? That is more important, because poor intake of proteins like a macro or a micronutrient along with vitamins is also associated in reduction in a reproductive performance, since it alters as simple as an energy balance, and is directly related to reducing an ovulation maturation among women. This is another documented research which says this statement, stating that the poor intake has a direct impact. Inadequate nutrition is closely linked to female reproductive pathophysiology. It is also confirmed the fact that both bulimia nervosa and anorexia, two pathological conditions, are affecting 5% of women, specifically at the childbearing age, and are major causes for absence of period, causing infertility and miscarriages. So one needs to know from within, I might not have an anorexia nervosa or bulimia, or it can be as simple as I like eating burger and chips. Just because you like eating burger and chips, you cannot eat the same thing every day. Like burgers are rich in carbohydrates and chips is rich in fat. You cannot have just carbohydrates and fats in your food as dominating ones. So this is what we're trying to iterate here. Because overweight and obesity are two important factors that is closely associated among women during the reproductive age. Currently, it's also men whose reproductive parameters are being affected from 99 percentage to 25 percentage. So one of the important factors is insulin resistance, which is identified for people who do not understand, as simple as that the obese body has an hormonal imbalance, be it male or be it female. Put in simple points. Most common factors that would come associated with the lifestyle is PCOD. Um, Let's say you have identified irregular periods much earlier. Let's say you've married and you already have a history of irregular periods. See that you address your irregular periods, not your pregnancy, so that whenever you're planning for pregnancy, the PCOD should not be a point of concern. This is what I'm trying to iterate here, so that everything doesn't get postponed and everything doesn't get stacked up, so that the point when the moment in your life when it comes to like, no, I'm planning for pregnancy, shouldn't be the moment, okay, we have to start from scratch and we have to do many things. So these are all the important points of self-care or taking care of oneself. Though everything falls under metabolic syndrome, one needs to identify, because metabolic syndrome is a major social health problem, particularly in developed nations, which is very important. Why? Everybody tends to have their own busy life schedule. And the diet associated with deregulated dietary habits, sedentary lifestyle, increased age, augmented BMI. So this is also suspected to play a definite role, and particularly in gastrointestinal, you have a lot of gastritis issues along with your fertility or hormonal imbalances that comes to the picture. Hormones that gets imbalanced during a metabolic syndrome will be your FSH, your LH, associated with resistance in insulin. So insulin resistance would come up, that impacts. So there's lot of impacting happens. Interestingly, all therapeutic approaches used for the correction of, like, let's say, the insulin homeostasis in obesity and in patients with other things like lifestyle modification, weight reduction, to as severe as a bariatric surgery, has proven to restoring back ovulation and proper fertility management. So this is what the current research study identifies and also documents to say if you have corrected. When would this simple corrections is efficient? Once you identify it immediately, not dealing, being with it for 10, 20 years, and then over a period of time, if you suddenly come to say, I would like to change it, doesn't happen sometimes. Because if you have heard it correctly, I have used the word bariatric surgery, which means that sometimes surgery comes to the picture. Um, Before heading on down, are there any questions that can be answered? Okay, so I will continue to go ahead. So these are some of the factors that we have identified, how healthy diet and unhealthy diet seems to interfere with the reproduction and the safety of the reproduction. Abnormal body weight, irregular energy levels in the body, and does have a detrimental impact on both male and female. So the both ovulation function as well as the spermatogenesis function has an immediate correlate with the factors. Some documented factors causing affecting the fertility or causing an infertility. One would be the age plays a very important role. It is not necessary that you have to take care of your fertility health unless or until you're planning for a kid. No, there are healthy lifestyles to take care and move forward until you decide to become a parent. If not, it is good to at least self take care. They can avoid leading to any further serious any other health comorbidities. Some smoking, that specifically tobacco smoking, coffee, excessive coffee, not even one. Sometimes people get petrified, ma'am, when you say coffee. What is the dietary allowance? You can have a cup of two, but not excessive. Alcohol abuse, stress in such a manner that it literally hinders your physical body function, like irregular sleep, and then you're awake and then you're not able to eat, or you eat and then immediately sleep. This puts into a different cycle mechanism for your body. A sleep cycle is getting disturbed, your eating cycle is disturbed, so your body, rather than utilizing the food for the nutrition, starts storing, and then it puts onto obesity. Well, stress just started. Okay, nutrition style. The choice of food right now, the current generation, we've seen a lot of choice of food. My nutritional style of eating. You can follow any diet of preference that you want, but if you are planning, see that your nutritional style incorporates all the important factors that is important for the physical body, that specifically to the fertility aspect, and see how you can curb your weight also according to that. Don't get into one activity compromising the other. Environmental pollutants. Hope that you're not working on a hazardous area or a hazardous environment. So they too affect the ovulation, or as simple as your periodical cycle. All that comes to the picture. How I spoke about nutritional disorders, we already dealt about what a malnutrition is all about, and how overweight and obesity impacts the ovulation as well as the spermatogenesis. Nutritional related diseases is also seen. You are as simple as a vitamin D deficiency, vitamin B12 deficiency, the folic acid deficiency. You need, or the doctor will facilitate in identifying, see, these things are needed, and this is how you will try to incorporate to avoid at least an ovulation or obesity, or as simple as a polycystic ovarian. The metabolic syndrome is what we've been dealing so far, to say that you need to first identify where you are deficiency and where is the imbalance, and then try to incorporate what needs to be done. The conclusion, or nearing to a conclusion, is nothing but a healthy nutrition for a healthy ovulation, right? That's the minimum expectation. So the doctor would take care of your blood parameters, your proper internal organ functions, as is oxygen, hormonal balances is taken care. Nutritional intake is what this entire session is focused all about, and stress, which we've already seen in previous session, how stress impacts fertility is also seen. But how long would be one person's question or would be a couple's question for which, okay, my lifestyle is corrected, my hormones are corrected, and everything is corrected. When can one see the fruit of the effort that's been put? Just like how every month, every periodical cycle is one, oocyte releasing, and how every 64 to 72 hours we see a good sperm, maturing and coming out. So is how the ovulation cycle also works. So somewhere between a month to minimum 3 months of close monitoring of all your parameters has an impact in a healthy ovulation. That's why if you see, our doctors would say, okay, this month we will do this. We will see in next month how the improvement is. After the next month, okay. Why that next month cannot prolong? Because after 3 months, where we would see a complete change or an improved ovarian function or a spermatogenesis function, if it is not seen, it is high time to sit, to decide, to point out, to look into what are the further treatment lines or procedures available to get forward to that. Because if it is not going to happen within this 3 to 6 months, 1 to 2 attempts, if the body which is trying to change or adapt to, despite in your bestest lifestyle, in your bestest things, it's high time to take the help of the procedures. Now this is where the right decision making cannot say like, okay, you come to us, you come to a doctor at the age of 46. I waited so long, did everything, nothing worked, but at the age of 46, what is it going to work? Don't wait so long that you lose your window of opportunity, where even sometimes infertility or fertility procedures can bring in a change in the body. So the time management here plays a very important role, for which the right decision making is very important. Some of the factors that we've seen, major, the macronutrients and the micronutrients, some would be still speculating where is it available, how much to take, what to do, and all that. Here is a small brief about what a protein is all about. And if you're taking a particular type of protein, what is the quantity that is minimum expected and how much that needs to be taken. So if you're adding eggs in your diet, kindly add 2 boiled eggs, which is giving a protein of around 13.2 grams in your food. If you are eating fish, see that it gives at least 25 grams of protein is available in a portion of fish that you eat. If you're eating salmon, and it contains 20 grams of protein. Your steak contains 32 grams of protein. If you're eating a chicken breast, as minimum as just grilled, 100 grams of chicken breast would carry around 31 grams of protein in that. No, madam, we are looking something for strict nutrition. We have chickpeas, legumes, pulses, all coming on with 10, uh, 4 to 10 grams of proteins available in each of them. So we also have tofu, which has 26 grams of protein. So if you're looking for other alternative sources, you can also see into other food. The most important part, not all protein that matters, right? Even carbohydrate matters. So why it is very important? Because it boosts energy for the body. It helps a person to sleep better. It helps in preventing diseases. It also controls weight, probably you take it properly. Mood upliftment, provides fiber to the body, and it also has its other beneficiaries on digestive system, nutrition, and so on. So carbohydrates, it can be your wheat, it can be your rice, it can be your pasta, it can be your corn. Even fruits have healthy carbohydrates like bananas, apricots. Kindly incorporate. Your healthy fats, which is lipids, plays a very important role. Which are you going to take is very important. What are they? Your most important fat, which comes in the form of cooking oils, is the most important ones that you will see. We have plant-based oil, we have oils from rice bran or seed-based oil, and we also have oils extracted from other sources. So look into which oil is more important, because we have various sources of lipids. Your lipids comes from steroid, your waxes, there is the cholesterol in your egg also is a type of a lipid. So look into where you get what you get. Hope it does not affect your hormones. Let's say you find one of these words, this oil is extracted from the so from this plant, like a canola oil, but canola oil is having something else that also affects the fertility. Please look into it. That is why I have put all the sources of fat. You should see what is healthy to you, and most of the things you should see shouldn't be containing in your food. So that is the reason. Antioxidants, the key factors that enhances the self performance or enhances your fertility aspects, are found more in a lot of natural based foods. You cannot get everything as medicines, right? So your carrots contain beta carotene as an antioxidant, your garlic contains allicin, lemon contains hesperidin, tomatoes contains lycopene, which we always hear, apples contain quercetin, broccoli contains glutathione, black grapes contains resveratrol, walnuts contains tocopherols, turmeric contains curcumin, onions contain quercetin, green tea contains catechin, peppers contains capsaicin. So, most important, predominantly available, commonly available, our next door vendors would carry all these vegetables, which contains so much of antioxidants. Kindly incorporate them in your diet as per requirement. Foods that are rich in folates, your green leafy vegetables, asparagus, broccolis, fruits like papayas and orange, beans, peas, lentils, legumes, seeds and nuts, specifically fruits like avocado. In vegetables, very specially, we have lady's finger, this is okra, cauliflower, beets, bell peppers. Foods which are rich in folic acid that can be easily incorporated. So, last but not the least, it is how balancedly that you cater your plate and you take in. Let's say you ate continuously your healthy platter, and how would you gauge how is your body responding? So do not forget to visit back to your gynae to see, okay, this is my lifestyle incorporated, doctor. Is it improvising my fertility aspect? It's your doctor who's supposed to say that. So it's not like I've been blindly doing, I ate cabbage, I ate broccoli, I ate nuts every day morning. In my diet I eat one handful of nuts, failing to realize when doctor pulls out some incidents to say oops, and then you realize all your consumption is not being absorbed by the body, is sheer waste of time. So healthy lifestyle, constantly being checked by your doctor, are two important functions that anybody can incorporate to see that your fertility aspects are well taken care. So with that I would end the session, and thank you for listening.